So we have the TIF device into the stomach, and we have a retroflex view. And we're starting our fundoplication, starting at the 11 o'clock position. And the device is in position. And as we have the endoscope retroflex, you'll see the tissue retractor come out. And we're going to grab tissue here. And we're going to twist until tissue is obtained. And usually it's about 3 to 4 turns. So once we have tissue into the tissue retractor, we lock it in place, and we'll bring the device out into the fundus. And we're going to pull that tissue retractor to bring it out of the device so that we have more mobility. So once this is in position, we will set the device by pulling the device out of the patient. So that'll set it in place. And usually we'll twist the tissue retractor just to make sure that it stays in place. And right now we have a good position, and Jeff here, our assistant, is going to turn off the Sure. I'm hitting the fundus. He's giving me a hint that I need to set a little bit deeper.
Whenever you're ready, I'll do suction.
So now Jeff is going to turn off the CO2 that we have on, and he's going to suction slowly. And as he suctions slowly, we're going to pull the tissue retractor, and the tissue is just going to come into the device. And it's coming in nicely. So as we pull the tissue into the device, we'd like to wrap the stomach around as he brings the stomach or desufflates the stomach. So at about right here, we're going to close the tissue mold. And when we close the tissue mold, we're going to push off the diaphragm. Right here. We're going to push off the diaphragm. The mannequin's moving. And there's an unlock mechanism here. As we unlock it, we can actually fire. If you can clear the lens.
This one, I'll give you that.
Okay.
Let it clean off.
Okay, so if we big knob away so I can see where it fired. And right here you can see the tissue, the fasteners in place. So that's a good first position. Now we're going to reload the device by pulling these back. It's not clicking.
Just switch out the cartridge. I'll be empty.
We're switching the cartridge over. Looks like there are a lot of people on the device, so it may be empty of fasteners. So we're going to reload the fasteners. And we're putting in another set of fasteners. And usually here we'll make it a little bit less shallow. And go ahead and turn the CO2 off. And as Jeff suctions slowly, you'll see that the tissue is going to fall into the mold. So when we see that we're losing a little bit of tissue, we'll turn the tissue retractor a little bit to try to grab more tissue. So at about right here, once I have a good length, he's going to keep suctioning, and we're going to give it a little bit of a wrap. Hopefully a little bit more wrap than the first time. we'll close the tissue mold and he'll re-insufflate the lumen so that we can see where we are. And look left, re-insufflate. So that looks about good position right here.
Counter rotate for us to show them where the tissue mold is.
So right here it looks like probably a 3 centimeter length, and we're going to push off the diaphragm. And we're going to unlock this mechanism and fire the fasteners. Go right a little bit. And then you'll see that that's the second set of fasteners that are placed right there. And then we'll repeat that, and then we'll swing around to the 1 o'clock position, repeat those in succession, and then we'll create the valve along the greater curve in a similar fashion.